My name is Victor Marchetti. I have a degree in exercise science. I am a CSCS certified coach. For those of you who don't know what that is, that's a certified strength and conditioning specialist. I've been involved in all sorts of aspects of health and wellness, fitness in particular, whether that's competitive athletics or working with your general population, folks dealing with comorbidities, sicknesses, chronic illnesses of all kinds, pain, mind and body. Uh, Fitness is my passion. Health and wellness is also, but I think that a lot of times people are focused on the wrong aspects or the wrong information in regards to how they should be approaching exercise and nutrition specifically to enhance the quality and the length of their lives, right? And don't be confused. Those two should go hand in hand, quality and length, not just length. And that's where individuals such as yourself come into play more and more. So fortunately seems to be the trend, but individuals who are willing and able and knowledgeable enough to maybe argue the common narratives and what has primarily become reactive medicine as standard practice. And we're trying to get ahead of the ball and start to implement different types of therapies, and not just therapies, but lifestyle modifications, behaviors that are conducive to being proactive when it comes to our health, especially as we strive to have quality length of life. So that's a little bit about myself. Doc, why don't you tell everybody a little bit about more about Next Health and
well,
what you
hey,
do?
there's a lot to, yeah, there's a lot to just spin off from what you just said. So as far as I'm a medical doctor, I understand that disease cannot be fixed by dealing with a prescription alone or focusing on the endpoint. And what Victor, I'm going to call you Vic. What Vic described is both of our passions in lifestyle. And what we want to do is make it enjoyable. And so the lifestyle is a prescription because I said so. I'm a real doctor. That's just emphasizing the point. So if I say something, it's a real deal. It's not lifestyle. It's not fitness. It is medicine, real medicine from a real doctor. And so what we're going to talk about is real medicine, how it pertains to lifespan, which we call longevity, but we also look at health span. And so that is underestimated. And oftentimes you go to your doctor looking for health, you went to the wrong doctor. Doctors are trained in disease like myself. We had to go out of our way to go learn about life's health span. And what we found now with cutting edge science is that lifespan and health span actually can prevent disease or reverse disease. So let it be said that I've been a physician for 30 years. I'm an MD. And as such, I try to bring and deliver results through enjoyable processes. And some people like to call it a lifestyle. All right, Vic, where should we start next?
Well, so just one more point based on what you said there is longevity, lifespan. This is an area of growing interest. So I think that the information that's out there, there's a lot of really good information, but there's also a lot of confusing information. So for our purposes, we know that our audience may have an interest in these sorts of subjects, but we will do our best to try to simplify some of the terminology, some of the things that we're talking about, so that the average individual can kind of comprehend it and digest it. But with that being said, there may be some terminology here today that other people aren't familiar with. So we'll try to make sure that we define anything that is potentially a little bit confusing. So to go into our topic today, how does exercise and nutrition interact and interplay with all the other variables of lifestyle to facilitate lifespan, quality lifespan, or to degrade it, right? So I think a good place to start, because this is an overarching theme that not only relates to what we're going to talk about, but also shows how some of this is tied together, is this concept of oxidation. Doc, can you do me a favor? Can you simply define oxidation and how that generally equates to health or lack thereof?
Vic, you like jumping into the deep end, don't you, my friend?
Yeah.
But so let's try to give you simple analogy, then a little bit more medical, and then the real implications. So, often people use the analogy that if you had an iron skillet and you leave it in air and oxygen, it's going to get oxidized, it gets rust. That's true. That is oxidation. Of course, that's not going on in your body. Then another person would say, if you cut an apple and it's white on the inside, wait a few minutes and see if it turns brown. That's oxidation as well. Same with the potato. Potato, by the way, has vitamin C, which is an antioxidant. So when you leave a peeled potato open and it's not submerged in water and it gets brown, that's oxidation. In fact, if you have vitamin C, it should be, and it's a powder particularly, and you open the lid and leave it open and don't close it properly, that fine white powder will become yellow and brown because it's becoming oxidized. So antioxidants can become oxidized. Now, the question really is, in your body, is it rust? No. Is it an apple getting oxidized? No. So the pureness of medicine, as I told you, I'm going to give you a medical answer followed by the real implication, is that oxidation is when you lose an electron. And people that follow us or will follow us over time will understand what we eat is not for what we want to eat for calories, is what the microbes want. What the microbes interpret and metabolize will send signals. And those signals can be inflammatory or anti-inflammatory. They can also cause oxidation. So really, you're going to learn that oxidation is the crux, because at the root of blood pressure is oxidation. At the root of blockages is oxidation. So there's the real implications, but it's in your diet, your fruits and vegetables, your antioxidant. And on the biochemical, it's the fact that if you lose an electron, you're now in an oxidated state. Oxidation is a loss of electron. Now that molecule is unstable, so it'll steal an electron from its neighbor, making the neighbor unstable. So it can become a vicious cycle, because certain level of oxidation is within reason, can be dealt with by the system. It's only when it's being overwhelmed. I'll give you some examples before I shut up. And that is that, so you now have cholesterol, which people think are bad. It's not bad. They think high is bad and low is good, and that's again wrong. And low is good. That's wrong. It's cholesterol is necessary for hormone production, the brain, and so forth. But I didn't want to dwell on that. Oxidized LDL is the problem, just like it is in blood pressure, just like it is in blockages, because it's the oxidized LDL, the oxidized cholesterol that causes it, right? Why? Because it's stolen electron. And these cholesterol sit on cell membranes. They sit on cholesterol. So if you make the cholesterol unstable, it's going to try to stabilize itself by stealing it from its neighbor. So imagine your cell membrane made of fat, and one part of it stole it from the next part, and the next part still, it's called a cascade. As I said, I'm being melodramatic, but when people get into that cascade, after many, many years of abusing themselves, and by the doctors not understanding oxidation because they didn't even measure it, let alone believe in antioxidants, it's oxidation, when it's unchecked, becomes a cascade, and it becomes a constant cycle of instability, and it's reflected by blockages. So I made myself clear. Shall I summarize it real quick? It's when the vegetable or the fruit or the potato looks brown, that's oxidation. On the other extreme, when you have blockages and blood pressure, that's oxidation in action. And the thing in between is the loss of an electron, which is okay for a while if you have enough donors. You eat enough fruits and vegetables, you're going to be able to donate those electrons. But if you'd never ate your fruits and vegetables, your system becomes overwhelmed and the body starts to steal it from its neighbor. That's how also DNA damage happens. It's like trying to repair itself, and then I'll stop. Carry on.
No. Let me ask you a question, because this raises a good point. I have this conversation with clients all the time. People ask what sort of supplements should they utilize, whether they're for performance or just general health and wellness. I'd argue that the two go hand in hand, right? We should be able to perform for life first and foremost. So I think any sort of micronutrient supplementation or anything like that is performance supplementation, right? Do you, in your opinion, think that the average individual, with the quality of the foods nowadays that most of us have available access to, do you think the average individual can get all of what they need through whole food dieting only?
I'm smiling.
I know my answer. I just want to.
So many questions that we could ask, but for the audience's sake, I'm going to try to break it down a little simply with the question, right? I know you know the answer, but I'm going to start. So a lot of people ask, which one is more important, nutrition or exercise? And so let's start with that one. And then we can talk about the quality of the nutrition. How about that?
Sure.
You know, so which is more important, Vic, nutrition or exercise?
Oh, they go hand in hand. You can't, it's like the chicken or the egg, which one came first? I think you can't separate the two. I don't
All
think
right,
one
let's go
is
to the
more
next
or less.
question, then we'll go back to the first one. Yeah,
Okay.
sorry about that. Go ahead.
No, I was just going to
So
say
what
in
do
my mind
you,
that they should be prioritized equally.
sure. Okay. And so, of course, you see a different group of clients because, you know, for me, I see a range, actually. It's not one group. I see the really sick and I see the really healthy and everything in between. So I have a different perspective. So the next question is the quality of the food, right? The quality of the food you asked, right? So what's your thought on quality?
I think that quality is generally subpar, right? What most people are able to access in the supermarkets and things like that, due to whatever arguments you might want to, monocropping, the degradation of the topsoil, nutritional deficiencies in the
That's it.
soil,
You
the
got it.
microbes,
You got
all
it.
that stuff. So in my
Yeah.
opinion, the food is subpar that most people have access to. And even those of us who have access to maybe higher quality foods, we're able to access truly sustainably cultivated meats and animal proteins and raw dairy and vegetables that are actually,
Right.
harvested in a manner that perpetuates healthy soil and all of that stuff. I think even for that type of person, it can be tough to get enough of what you need from just your
And
food.
I'm going to give you exactly. I'm going to give you my opinion on that one. Then we'll go back to which one's more important. It's a trick question. This really isn't one answer, but we're going to give the science. We're going to have a discussion. So at the end of that discussion, the audience can figure out for themselves because everyone's different. It won't be the same answer for everybody. So as far as I'm concerned with quality, what I would like to say is that just because you see something on the outside doesn't mean that the inside is the same nutrient value. You can have two apples grown differently and the inside is different. It's like me and Vic. I mean, I look just as good as Vic when I take off my clothes and show you my six-pack. But clearly Vic is much fitter than me. So looks are very deceptive, my friend. And why? Because they could have been genetically modified. The fact is, on a genetic level, it's molecular changes which you cannot see. It looks like an apple, looks like a banana, looks like a salmon, could have been modified. That's what I'm trying to say about oxidation. You cannot see it most of the time. So, too much sun damage, that's oxidation. You can see it sometimes.
The trained
spots, oxidation, yeah. With a trained eye, you can see it. But that's my point. My point is, if it's not in the soil, how is it going to be in your food? If the soil, as you said, has been depleted, you have to replete it. Or what we are supposed to do is crop rotation. Rotation, right? There's a great analogy in that. When you do crop rotation, you have healthier crops because some crops leave nitrates behind. Some of them, the byproducts leave other nutrients for the next person. It's like the ecosystem when, one animal eats another and then leaves something behind and somebody else breaks that down. And bacteria is obviously the final story. So the same thing applies to when we say crop rotation is healthy for our food chain. How about rotating our diet as well? What if you have the best diet and you do the same diet every day, day in, day out? I look intense. Do I look intense?
No,
do I look angry, Vic?
Nope.
I don't know. I'm just like I'm trying to say to myself and yeah, I don't know. Just let me know when to back off a little bit.
No, you're good.
So you need to rotate. So I was trying to be a little bit, I was trying to, push you in a direction. So you got the best nutrition, but you're doing it every day. It's not good because you have to have diversity. You have to have rotation because when you rotate the food, the microbes in your gut also rotate. We call that diversification. A diverse gut microbes means less inflammation. A lack of diverse, because this is a very general terminology. There's no easy terminology. A lack of diverse microbes because you ate in a less than diverse manner is more inflammatory. Now let's go back and I'll go back to Vic and see if he wants to add another layer because certainly I can add more layer to it. Which is more important? It's a trick question, nutrition or exercise?
Like I said, I would like to think that contextually they both need to be taken into consideration. But I would say that from maybe just a overarching perspective, a 30,000-foot view, I'd say it'd be probably in most people's benefit to try to prioritize the fuel that they put in their bodies first and foremost so that they can then perform in life, right?
Yeah. For me, there's a diverse range. I've got the young, I've got the teenage, I've got the young adults, I've got the athlete, I've got the so-called healthy 36-year-old, the 40, the 70, the 90. I got the whole shebang. Yes. So I would say that each one has to be customized different. That's the trick question.
Mm-hmm.
There is not an answer, because
Mm-hmm.
for the general population, which I suspect my audience particularly tends to be, between 40 and 60, although they're getting younger and they're getting older. So I'm getting more people, which is the way I like it. I think I should be able to handle 90% of the population. I should have the message for 90%. 10% is for the hospital or very rare stuff. Sure. I want to talk about the 90%. Anyway, the point I'm saying here is that for the athletes, they may be coming in because of a different set of problems, like they've overtrained, they've overexpended. That means whatever they took in, didn't match the amount of expenditure, because they either burnt too many calories, they worked out too hard. Excessive exercise causes oxidation. Mm-hmm. Excessive exercise causes inflammation.
Right.
And the way to counter that for an athlete is to make sure you rest enough, or you use therapeutic tools like hyperbaric oxygen chambers to reduce that inflammation, or you take a boatload of antioxidants. Because if you exercise like a freak, you got to eat like a freak. That was just a terminology I took from somebody who mentioned it about bodybuilding. And then the next group, which is really a group that as a doctor I see, which is that, doctor, I've got maybe some health issues, blood pressure or cholesterol, I've gained some weight, maybe, I don't have energy. My prescription isn't exercise first. My prescription is figuring out why the body's not working right, and to turn off the bad signals, replace what the body needs, make the body function better, so it then starts to feel better, and then you can exercise. And exercise is a loaded term, because what I want to ask Vic is, what do we mean by exercise when it comes to duration and intensity? Where do we start? Mm-hmm. Let's just start for everybody, audience.
So first, let's define physical activity, right? Physical activity involves muscular contraction or movement of the body, and for energy to be consumed. A lot of people today are focused on, did I close my steps ring? Did I get my 10,000? That's great. But exercise, what you have to change about that definition is that it's planned, it's structured, and it's got a target. It's aimed at improving one or more facets of your physical fitness. Planning, that's the big thing there. Planning is where you need to start. So you need to have an assessment done in regards to what are your limitations, what are your actual current capacities, capabilities to operate safely. Where can you start safely? And that's for everybody. And some of that requires some communication back and forth between you and a coach, you and a physician, you and a team of some kind, right? We all have to have coaches in all aspects of our lives. We don't have to, we can choose to, but I think that there's benefit in having coaches in all different aspects of your lives, whether it's, have a business coach, you have a psychologist or a therapist, you have an individual who's responsible for handling your health and wellness and the different facets of that, a team. So a good physician, you have good coaches, good trainers, good dietitians, nutritionists, whatever it might be. And that the need and the desire varies for everybody, but the plan, because you have to start with a blueprint based off of some sort of metric, some sort of understanding, some sort of conversation, some sort of assessment, and then go from there. And that's where the coaching and the planning comes into play. It has to happen in real time. There is no one size fits all. So if I was going to tell anyone who wasn't working with somebody in terms of a trainer or a coach, and they were exercising and trying to figure out how to go about it safely, first, trust your intuition. That's a big one. They say that like our brain, our heart, and our gut have neurons, nerve cells that look just like the ones that are found only in the brain outside of those other two areas. And you correct me if I'm wrong, but from what my understanding is, there are neurons found in the brain, the heart, and the gut. So trust your instincts, because a lot of times they're leading you in the right direction. The other thing is intensity can be a very vague term, right? So people are saying, okay, should I train with high intensity? Should I train with moderate intensity, low intensity? What's better for burning fat? What's better for... The answer is varied and also differs based on context, the individual, their capacity. But generally speaking, if you were trying to come up with a basic blueprint for how you should exercise, I would say start with 2 to 3 days per week. And this just means something structured. So that could or may not involve any sort of resistance training. It could be, again, any sort of planned, structured exercise physical activity that has a goal and is aimed at improving some aspect of your fitness. 2 to 3 days a week minimum. Start there, separated by 1 to 2 days between each of those training sessions. And I'd say for the vast majority, the majority of your workout, let's say if you go to the gym and you work out for 45 minutes, 80% of that should be spent, if not more, should be spent at an effort that feels like a 2 or 3, maybe a 4 out of 10. Saying one is like, okay, I could do this all day. This isn't challenging me whatsoever. I can sing a song right now. Okay. We use that analogy or that metric sometimes as a subjective way of measuring intensity. Okay. So if you're exercising at a low intensity, you should be able to sing a song without having to stop to gasp for breath. If you're operating at a moderate intensity, you should be able to talk in full sentences without having to gasp. But at the end of a sentence, you may have to stop and take a breath. If you're working at high intensity, it's very, very hard to get more than 1 or 2 words out without having to gasp for some air. So I would say for most people, you should be able to sing a song when you're exercising, maybe start to push into that realm where, okay, you can talk in complete sentences, but you have to catch your breath a little bit after a full sentence. Somewhere in that range, 2 to 3 days a week, doing whatever you want within reason, listening to your body and doing your best to stick to 45 to 60 minutes of that structured and intentional routine. So that's what I would say. 2 to 3 days a week, 45 to 60 minutes a day, low to moderate intensity, generally speaking, and listen to what your body is telling you. If something hurts, back off of it. If something is challenging, that's okay. You can lean into it. But again, you have to listen to your body. If your body is telling you that that's probably not good for you, listen to it. It's okay. But that's where the coaching and having somebody to help guide you through this sort of experience or this sort of scenario is most beneficial for most people, as it takes the guesswork out of it. It helps them feel like they have somebody who's in control and steering them in the right direction and helping them adjust in real time. And that's part of what we do, right? In both of our respective fields.
All right. Well, excuse the multitasking. I was just checking on my clients in the hyperbaric, make sure the oxygen's on there and everything's going A-okay. So just to spin off and add my 2 cents on it, although I may not be an athlete, but I know when I'm performing at a good level, and then I know when I'm performing at a lower level. And what's always very, very important is that when you getting back into it, or you're starting for the first time, it's important for me to have a regular schedule. And that's what Vic was saying, planning. Make it realistic so it's achievable. Setting yourself a target that's going to fail, it's just not going to end well. So setting yourself once a week, so long as you can achieve it. Some people say, well, that's too little. A lot of people say it's too little and they go too fast. That's the problem. So then, well, okay, once a week is too little, and I think it is too little, but say twice a week, that's fairly regular. 3 times a week is actually not bad. Now, do you want to do 3 days in a row? I mean, look, there's some benefits of doing it 3 days in a row. Do you want to do it Monday, Wednesday, Friday? I think more important than which is physically better for you is more like which is mentally, emotionally better for you. Because it's got to incorporate into your lifestyle. Because if it isn't, it's going to be painful. And I'm going to skip here. Vic said, level 2 to 4 out of 10. That's so realistic because, with him, I think he's like 8 and 9. But he's talking to you. Maybe he'll go to 8 and 9 when he wants to. But he's talking to you and me, maybe. And I think it's so important to enjoy it, right? So if you don't want to go to the gym, fine, don't go to the gym, go to the basketball court. If you don't want the basketball court, then go walk around the park. If you don't want to do that, then, find what you like. And the operative word is activity, right? And there's science behind it. I want to give examples of that. So now, number one is get a routine. And once you achieve it, then increase the frequency. Then once you increase the frequency, then I think you can increase the duration. Start with 10 minutes. Why give yourself 30 minutes? Say 10. Okay, I did it. Great. Now, a week later, do 15. I achieved that. Great. Now go to 20 or go to 30. But don't start at 30 because 30 sounds so easy. Again, it just depends. If you're just getting into it, that's a hard 30 minutes. When I'm not out of shape and I do 30 minutes, I'm like exhausted. And then so the idea is that planning ahead, like he said, the intensity should be something that is enjoyable. When you're not enjoying it, it's a problem. Now, of course, once you get into it, like what Vic will tell you is that he loves the burn in his thigh because he knows that he's pushing himself. Now, not everybody else is going to enjoy the burn. Don't do it then. and someone is going to be so out of breath they can't even talk. Well, that's because we're trying to get into our zone, and then we'll step back. But that's not for everybody. We now want to give you the science. Let me give you a real science, because now that people are not worried about COVID, thank God for that. But, there was a study by Kaiser that said that people who are active had less risk of hospitalization and death than people who had blood pressure, diabetes, and blood pressure, heart disease, diabetes, you name it. Why? Because now we can spin off on the why. And let me repeat what I just said, that if you have diabetes, blood pressure, cholesterol, you would imagine there's a little bit more risk of hospitalization and death because of COVID. You're wrong. The people who are sedentary have a worse risk of it. So Kaiser defined activity, and this is in line with what Vic just said. They said 150 minutes a week. That means 30 minutes a day, multiplied by 5 days. There's some metric right there, 30 minutes, 5 days. And they did not say 9 out of 10. They actually didn't give a number, but they said activity like walking, where you're a little out of breath and maybe your heart is racing a little bit, like when you can still hold a conversation. So that to me means a level 2 or 3 out of 10. Yep. So that is what the science has shown. That's what we are saying. And now I want to just throw the seed or plant the seed, which is that what type of exercise, what type of nutrition has been shown to advance longevity. So I'm going to go into that in a minute. But do you want to elaborate on what we just talked about or add anything?
Actually, I do. You touched on something that's very important, frequency versus intensity. And that 100% has to be the right balance. The more frequency you practice, generally speaking, the more you have to dial back the intensity overall, because with increased intensity also comes a increased amount of oxidative stress, increased need for recovery. So again, if your nutrition isn't lined up to support what you're doing from a physical perspective, now you're also really having a tough time and fighting an uphill battle. So that was number one. So I 100% agree with that. Some of these things that upregulate some of the beneficial metabolic processes and the good stuff that our body does in response to the appropriate dose of exercise, those rebound times are limited. So let's just say, call it within 48 hours of finishing an appropriately scheduled training session, all of those things that are upregulated that start to tell your body, hey, we have to become stronger or more resilient or more fit or whatever it is, those things start to go back towards baseline. So you want to make sure that your frequency and your intensity are in balance so that you're stimulating the body to adapt in a positive way without burning it out or without falling short of being able to continue to progress, instead of just kind of doing this up and down in place where you're going up and then back to baseline, going up a little bit, back to baseline. We want to see it like walking uphill with a yo-yo. The yo-yo goes up and down, but as you walk uphill over time, there's a net gain. So that was the first thing. The second thing is sort of bringing it back to that concept of oxidative stress. And you mentioned this earlier. Too much oxidative stress is a bad thing for most of us, generally speaking, right? Exercise-induced oxidative stress is still oxidative stress. But there is a fine line between enough oxidative stress to promote what we were just talking about, those beneficial upregulations of certain things, that bringing the system up to speed, trying to adapt and to become better to then be able to handle that stressor when it shows up again next time, versus too much where it starts to put you in a hole. So my thought is that is where a coach's expertise and the coaching process itself is irreplaceable, because it's up to, for example, for us, someone who has access to sort of program we do with our exercise and nutrition and a holistic approach to some of the stuff is, one, we know metrics. They see you, they know what their lipid profiles are, they know what their deficiencies are, they know what their limitations are, their restrictions. That gives us baseline information to assess where they need to start in theory and what they need to do to improve from both an exercise perspective as well as a nutritional intake perspective. But everything changes once you start to change variables. So as soon as you start to implement that exercise and nutrition program with some consistency, there's going to be two things. One, some discomfort, meaning either a physical discomfort or psychological discomfort. Improvement of any kind requires discomfort. Just like with exercise, it requires you to get uncomfortable to stress the system enough to adapt. Changes in lifestyle, same sort of interaction there. It might be a little uncomfortable, it might be out of the norm, but if you stick with it, you'll become more tolerant of it. It'll become more normal. It will feel more comfortable with time. The other thing is that pain that you experience when we really, for example, the burn in the thighs. There's research that shows that people who truly perceive that discomfort to be good for them have a much better rebound and a much more positive psychological experience because subconsciously they know that this is good for them. So that pain or that discomfort becomes something they actually look forward to in a sense because they know what the residual effect is. So that is to me something that a lot of people fail to realize. And once we start on that journey, the amount of stress or discomfort that we need to continue to move forward has to be monitored so that it's not taking us the opposite direction. And that's where the communication daily, messaging back and forth with you or myself, or having us update your protocol based on the fact that you were doing something silly and pulled a hamstring when you were dancing at this party and had one too many drinks the other night, because again, life also happens and this has to be conducive to your life. So it's not just a set it, forget it. This is what it is. Follow it to the T. No, this is something that's biological in nature. It evolves, it changes, it adapts as the scenario and the situation does as well. So that's all I wanted to add to what you had said.
I mean, so I think you focus on oxidation. Let me just go back to its purity and then try to give you a bird's eye view. So oxidation is part of the normal metabolic process. So if you want to get fuel, you have to have oxidation. In fact, if you want to burn any fuel, you need oxygen, and that's called oxidation. So that's a normal phenomenon. If you eat too much, you're going to get oxidation. If you eat too much saturated fat, you're going to get oxidation. So you can create excessive oxidation by eating the wrong stuff or just eating excessively. Okay, so oxidation is a normal phenomena. And again, if you have a normal amount, then your body is more than able to accommodate it under normal circumstances. How about if you're an athlete? As Vic was saying, the amount of exercise you're doing is creating excessive oxidation because as you're fueling the muscles, you have to burn fuel to fuel the muscles. And the byproduct is oxidation. And so excessive oxidation is revealed because marathon runners have more heart attacks than the general population because of excessive oxidation. Now, that part I just said, because of excessive oxidation, that's my opinion. But the marathon runners having more heart attacks, that's not my opinion, that's a fact. Is the study I told you, that's not my opinion, that's a fact. I'm trying to give you an explanation because in many studies, they don't give you the process. They don't tell you the what exactly caused it. But because I'm a physician that tries to understand it, and because I practice it, I have a better understanding of it to be able to explain to you that this is what I think it is. And I'm going to be much more closer to being right than the average doctor that has no understanding of nutrition exercise. So I try to give you two examples there, that if you have normal nutrition, you have oxidation, that's acceptable. Excessive oxidation by putting in the wrong foods, those chemicals that you put in. Supposing you have chemical byproducts, you know that they put arsenic on the things that they spray crops like rice in certain parts of the world. Well, arsenic is a heavy metal, it's a toxic metal. That creates oxidation. So you have chemicals in your food chain because of glyphosate and other chemicals, including fluoride in your toothpaste, by the way. So those are all chemicals that in excess create oxidation. So that's what's going in. You can produce excessive oxidation. Maybe that's why people who overtrain get injuries, because they are creating oxidation. They're creating more inflammation. So the tissues are weaker, so they get into injuries. That may be why athletes come back over and over to me, because they are saying that I keep getting repeat injuries, because you never matched the antioxidant with the oxidation. You never matched the anti-inflammatory with the inflammatory, right? I said in reverse. Usually people create pro-inflammation and inflammation. They usually create pro-oxidation and oxidation. And so that's why the nutrition is kind of important, but everybody's journey is different. And, you get somebody at the age of 40, well, you have to look at the journey from actually probably even earlier than 20 and 30. You can't start the journey at 35, let alone 39. when you get somebody at 70, you can't start the journey at 50. You really, that's what a good history is all about. And maybe I'm sounding melodramatic, but it isn't actually. So it just depends on how complicated the person is in the front of me. The more complicated they are, the more of their journey I need to figure out over a period of time. But just like I make a judgment, I'm judging by someone's appearance. I'm making a judgment by the way they sit, the way their brain is responding. All these things are part of the cues. And again, I'm going off at a tangent, but I'm going to get back to what is it about certain nutrition? What is it about certain exercise that relates to longevity? Because that's what I said I was going to talk about. And I'm going to try to put it all together, that it's from the beginning to the end and everything in between. End means you're dead. The beginning is when you're healthy, and everything in between, if I can be so blunt. So the point I wanted to make about it is that intermittent stress activates longevity gene. So if it's high intensity interval training, which Vic can explain a little bit more, or if it's fasting, or what is high temperature hypothermia, or the opposite, low temperature hypothermia, cryotherapy, any and all of these intermittent stresses is what activates longevity gene. So if you're having 8 small meals a day, that's not going to be conducive for longevity now that we're in the 21st century. That may have been okay 20 years ago giving that advice. If we have an air-conditioned environment and we're very comfortable, that's not conducive for longevity. Am I getting aggressive?
Nope. But sometimes you need to be, even if you are. Even if you are, you got to... Yeah, you got to let them know you're being serious about. And this is a serious discussion.
It's serious.
If you were to say what,
it's so serious, I'm
continue.
Not done. I'm telling you, I'm not done. I'm trying to tell you, you're going to get uncomfortable. If you're too comfortable, now you may think I'm giving a lecture on philosophy. Well, I may be. Don't get comfortable with your education. Don't get comfortable with your job. Don't get comfortable with your relationship. I'm a counselor now all of a sudden. Because when you get comfortable, you're going to get complacent. Mm-hmm. If you want to be better, you got to make yourself uncomfortable. And my employees got to get a little uncomfortable, because if they come in comfortable, they're not going to produce. I got to make myself uncomfortable. I make myself uncomfortable by what I don't know. I make myself uncomfortable by saying, could I have done a better job? Why am I not routine with my workout? You got to get uncomfortable. But that's what the science is showing, that inside your cells, if you get uncomfortable, if you stress the body knows how to handle it, and that makes you healthy. I'll let you take over.
No, I agree. And the older we get, typically speaking, the more frequently you have to challenge the systems. That would be my general rule of thumb or advice, is more frequency and dial back the intensity to some degree. But this conversation we're having about the interplay of nutrition and exercise and the oxidation that comes along with poor nutrition, the excessive oxidation rather, that comes with poor nutrition or consuming the wrong types of things and overtraining. This is a combination that we see is rampant, especially in the populations that a lot of people idealize from an aesthetic point of view. So the average individual who looks like they belong or is on the cover of a magazine looks to be the epitome of health. I've coached bodybuilders and physique athletes. I've trained as one alongside of them. I will tell you right now that for the vast majority of those individuals, they never feel worse or are closer to being sick or dead than when they look their best. And that's a fact. So there's this whole culture of people who are overeating or trying to justify a poor diet or over-consuming rancid processed foods, the poorly sourced animal proteins, things of all kinds, and creating this pro-inflammatory environment, and then trying to kill themselves in the gym to elicit this calorie deficit, number one, so that they can continue to lean out and drop body fat. And they're also after some hypertrophy, which is just another thing that drives me crazy. That's a whole nother conversation. People who try to do both at the same time to any significant degree, but at the very least want to maintain as much of the muscle mass as they have as possible. Those folks are creating a lot of times a super storm of pro-inflammation. And even in recent years, there's been a ton of individuals who are these physique athletes in their 30s, 40s, 50s, dying of massive heart attacks, dying from stroke, from years and years of what was thought to be, healthy living. I kept my body fat low. I ate lots of protein and steamed rice and steamed vegetables or whatever it is. Um, that is the saddest thing about the commercial fitness industry right now is so many people are pulled in through advertising, marketing, and disinformation, information, poor guidance into this sort of practice. That's not sustainable, um, especially as you age. The residual effects of, like we said, just creating essentially chronic inflammation for years and years and years on end over the long term, that has significant effects on the body. Arthritis, other chronic illnesses, like you said, diabetes, cardiovascular disease, all types of things that inevitably will start to really diminish your quality of life. Who cares about the length at a certain point? It's like, well, do you feel like crap every day? So, what I was ultimately getting to is that this is a good definition. Aging in terms of how it relates to fitness, right? And we talked about, you know activity versus exercise being aimed and targeted, strategy based, planned based improvement in one or more aspects of your fitness. So aging is characterized by a progressive decline in cellular function. So the mitochondria, the powerhouse, the thing that ultimately makes the body do what it needs to do, is negatively impacted by excessive oxidation, excessive inflammation, right? So decline in cellular function. So we're really doing that when we're over exercising and we're under recovering, let's just say. And body fitness. So a decline in body fitness as well. Exercise and nutrition is hands down the number one thing that you can control to try to slow down that degradation, that decline in fitness. Aging is characterized by the progressive decline in cellular function and body fitness together with increased risk of associated diseases. So all
Yep.
of those things that we just
Yeah.
talked about.
Yeah.
So for me, that is the underlying philosophy that I think the vast majority of people should take into account when they're thinking about nutrition, sustainability, exercise. Sustainability is start small, like you said, make good adjustments, but maintain them with some consistency, and you can always progress. But the goal is to figure out how to make it commonplace and mainstay with what you're practicing so that you can see some results. A lot of people want to jump on and don't see instant gratification, so they jump back off. No, this is a long-term thing. And like you said, this ultimately needs to be a lifelong focus, because as soon as you don't prioritize it any longer, then you start going the wrong direction, most likely. So I'll leave it there.
Yeah, I mean, look, so I'll start off by just sort of making clear that when we're talking about intermittent stress being able to activate longevity genes, it's intermittent stress, not chronic stress. Stress can be from lack of sleep, stress can be from overeating, stress can be from overexercise, stress can be from eating refined and processed food. So there's financial stress, emotional stress, relational stress. Your body cannot differentiate the two. And yes, it's the HPA axis, but it's actually even more complicated than that. Whatever it is, it's chronic, that's the problem. It's intermittent, gives you time to recover. So that needs to be clarified. Then what Vic was saying about the loss of progressive loss of function is one of the, that's exactly right. So a couple of things. There are 5 stages of cell decline. So when you're young and healthy, you're at stage 1. And as you get into your 20s and 30s, you're at stage 2. Still pretty damn good. When you get to 30 and 40, you may be at stage 3. It's only when you start to get to stage 4 that your body's complaining, aches and pains and stiffness. And that may happen in your late 30s, early 40s. It's called dysfunction. So you lose function to get to dysfunction, and that's when the body's complaining. And you ignore that, or your doctor can't figure it out. Then he diagnoses disease. You cannot diagnose disease when your function is at stage 1 and stage 2. Generally, I mean, we're talking about the 90%, right? Probably 99%. So your doctor's not diagnosing you early when it comes to blood pressure because you're at stage 4 or 5. Your doctor's not diagnosing diabetes early because you're at stage 4 or 5, because more than 50% of your insulin is gone before the sugar goes up. More than 50% of your nitric oxide has gone down before the blood pressure goes up. Let me just repeat that again. So what we just said is that nutrition and exercise is the key to longevity as well as staying healthy and everything in between, because you can track the functional decline. I do that because I do what's called an executive physical. So I'm going to give a shout out for what I do, and then Vic can give a shout out for what he does. Then I'll go back to giving you the science behind it. I am an MD that deals with functional medicine, because when I know somebody's genetics, when I know somebody's brain function, when I know somebody's DNA age, when I know their nutrient deficiencies, when I know which food is inflammatory, when I know if they have insulin resistance or inflammation or liver toxicity or fatty liver, then and only then can I help somebody identify which stage of the cell decline they're in. Are they the dysfunctional? Probably, because that's why they sought help. But if they're smart, they would come to me even before that, because I can try to give them an idea of the blood vessel function, the immunological function, the gut function, the liver function, the brain function, the DNA function. They're not all equal, but the DNA is probably the one that holds it all together, because we call it the epigenetic age. There's the intrinsic epigenetic age and then the extrinsic epigenetic age. The intrinsic epigenetic age is more of an immunological function of your body. The extrinsic epigenetic age is more the vitality. They have overlap. But anyway, before I go into any deeper than that, to keep it simple, as I said, there are 5 stages of cell decline. Now, you can prematurely age yourself. Don't sleep, you'll prematurely get old. Eat a lot of refined carbs, you're going to get older. They all work in different mechanisms, but they'll all go to the same endpoint, which is dysfunction leading to disease. And when your doctor says, you just got borderline blood pressure, no, your nitric oxide is actually lower. So nitric oxide is one of those things that come up when you exercise. So not only is it good for lowering blood pressure, it will increase the blood flow all over your body, not at least your erection. So 40% of 40-year-olds have erectile dysfunction because of low nitric oxide. 50% of 50-year-olds have erectile dysfunction because of low nitric oxide. 60% of 60-year-olds have erectile dysfunction. Now, those numbers are actually going to get worse over time, not better. The reason why Viagra works is to keep the nitric oxide that you have in your body longer, stopping the breakdown of it. It stops the breakdown of nitric oxide. Now, if you don't have any, there's nothing to break down, so they stop working after a while. I just say that because I think that's something that, well,
people can relate to and understand.
50% of our population are men, right? So I'm going to hit 50% of them. And of the 50%, there's 40-year-olds, 40% of them, and 50%. So it should get the point out loud and clear, because you can't see the blood flow in your brain. You cannot see the nitric oxide in your blood vessels. I have the tools to measure it. One of the ways I can measure it is by looking at how soft they are. So when your blood vessels have nitric oxide that are not only soft, there's less oxidation in the endothelium, that means inside the lining of the arteries, so they don't get the plaque, the calcium and cholesterol. They can only happen if the environment is suitable. The environment is that the particles are dense, not high and low, not quantity, quality. And then you face oxidation. That's going to then attract those dense LDL, the dense cholesterol, to enter into the blood vessels. And as a result of the immune response, which the monocytes go to address the oxidation, leaving macrophages, and macrophages become foam cells, then those cells die, leaving a central necrotic tissue. That is the hallmark of atherosclerosis. That is the hallmark of blockages. And it all started because of oxidation. And then when at the late stage, this is a little bit medical and technical, but it's important for people to understand that we understand that medical and technical, because if you don't catch that vicious cycle, your own nitric oxide, a different type of nitric oxide called the inducible nitric oxide, adds more nitrogen oxygen species. It creates more oxygen. You get into a vicious cycle. You get into a vicious cycle. So the plug to me is that I'm an MD that understands how to rethink medicine, to be able to predict things, prevent things, and prolong life. And I have tools and therapies, whether it's a hyperbaric chamber, IV vitamin therapy, chelation, antioxidants, things that support liver detoxification, things that improve insulin resistance, by the way, by detoxifying ectopic fat. That's fat around your belly, inside your belly. I mean, these are medical terminology which your doctor has never mentioned because he's lost without a prescription. And the prescription is lifestyle. The prescription is nutrition and exercise. The way we've just been explaining for the last 30 minutes, it looks like I'm never going to stop talking. So I will stop just after I say my final piece, which is that this is for staying healthy and keeping in high functional state. And to slow down the aging process. We're not, when we say anti-aging, we're not going to make you into a 1,000-year-old person, but you're all aging prematurely because your performance has gone down in the sack. Your performance in the gym went down. God knows your brain performance has gone down. I'm just being very aggressive again. But, when I get excited about all this, my nitric oxide is going up. My endorphins is going up. My glutamate in my brain is going up. That's why I'm so excited. And we need to get that excitement into the people. So you and I are in the business of making it enjoyable to get results far superior than the typical MD. So let me just slow down now.
And just to kind of wrap that up is people have to find some enjoyment in what they're doing if you want it to be sustainable, right? And if at the very least, if they don't, they have to have some understanding in regards to what the why is behind the prescription, the lifestyle modification prescription, the exercise prescription, the nutrition prescription, whatever the prescription is. I would argue that everybody should try to access a facility like Next Health. There aren't very many of them. To have some preliminary executive physical tests run, even if you can't do the full gambit, they're professionals like yourself are there to say, okay, well, based on what I'm seeing, based on your age, based on your medical history, like I think that what we need to just touch on first and foremost is this. How do these few things look? Let's address that. And then let's make any necessary changes we need to try to make improvements in just these very acute areas and then go from there. So for us, somebody comes to you, and what we do as in our partnership is somebody comes to you for an executive physical and an assessment of some kind, right? Based on the information that you attain from that executive physical, that assessment, you and I consult with one another in terms of what does this person need from a nutrition perspective or supplementation perspective? What do they need to avoid in terms of food sensitivities, food intolerances? What do they need to consider in their exercise because they have extremely high blood pressure or they're tachycardic or whatever the case may be? Then that individual communicates with me. I set up a time to speak with that individual. And if I'm able to, and I'm in the area, to actually meet with them in person to go through further assessment on my end, because I have questions that maybe what you didn't fully answer for me. And between that process of having metrics and quantitative data based on their internal function and their age and some of the things that they might have going on, and then based on the expertise that I have and my ability to communicate with them and deduce what I may need to avoid, what I need to take into consideration in terms of putting together exercise and dietary protocols for them, we're able to get them in the right place and find that balance between, okay, this is enjoyable, but this is also making me uncomfortable. And then there's the ongoing support that we offer in our communications, in our checkups and all of that stuff. And that's a very hard combination of services to find under one roof with expertise throughout the full spectrum of those services. So that's what we've been working on together, you and I, as of late, and trying to unroll that for some of your current patients as well as patients to come. And so far it's been really amazing. Just like anything, it's a two-way street, right? So we are fortunate that we get to choose who we work with. So just because you want to work with us doesn't mean that we're obliged to work with you necessarily. People have to be willing and open to changing some of their preconceived notions that they might have when they walk in the door and talk about trying to make improvements of any kind. You need to be open-minded. You need to be willing to be uncomfortable, or to maybe be open to the possibility that things that are counter to what you may have heard from who knows where for years and years and years. Times change, research changes, the data changes, and understanding changes. So things might be different. So you have to have an open mind and you have to be willing to put yourself out there a little bit, but you also have to come and uphold your end of the bargain. We could do all of the planning, all of the protocol development that we want, but unless you're willing to execute it with consistency, it's a waste of resources across the board for the individual as well as ourselves. So that's all from me, man. I actually am running on a timeline here, and I'm sure you've got some things that you have to do. I know you stay busy. So do you have any closing words you want to let
well, yeah, I do
where
actually.
they
Just
can follow?
the top 5 things that I would do is make sure you get good night's sleep. That's the best way to keep your hormones up there, be recovered so you can have energy in the daytime. The number one thing is to avoid bad things from going into the body. Those packaged foods are really bad for the gut microbes, which actually is your immune system, and that's where inflammation comes from many people. Then you got to eat the right foods. You got to eat the cruciferous vegetables. You got to have the fibers that feed the microbes. It's nourishing the microbes, not you. And then to supplement, because why are you taking vitamin D? Because you're low. Why are you taking B12? Because you're low. Why are you taking omega 3? Because you're low. Why don't you measure all this stuff, right?
Right.
And then we talk about which foods are inflammatory. And then we can talk about, so not only supplementing, then what we do at Next Health, it's about integrating those lifestyle, but using the science and data, and then formulating a package that is customized for the individual. So at Next Health, you can look us up with www.nexthealthmed.com. Next Health, NEXTHEALTH, med, MED. So nexthealthmed.com, or you can call us at 703-724-4000, 703-724-4000, and then we will get the ball rolling, and then Vic and I will partner together. And it doesn't matter which level you want to start off. Yes, we do the executive physical. I get it. So half of our clients are the people who are proactive and they just want to be at the top of their game, or they want to be preventative. The other half have dysfunction the doctor can't figure out. Actually, there's significant amount of people in there that actually have seen multiple doctors and couldn't. So I will take the complicated people, I'll take the young, I'll take the old, and everything in between. And if you're smart, you're going to come to me before you have a problem. But if you have a problem, I'm trained to do both. And so Vic and I are going to be partners in that lifestyle quest, but at a level that other people just think about. We actually practice it on day to day. I'll let you go, Vic. We'll do this again next week. All right?
Yeah, no, I appreciate it, Doc. And again, if anybody's interested, please make sure that you do as Doc suggested, either call, text, look them up online, because they're doing really amazing stuff. And I think it's going to become more and more the norm and more popular as the research continues, the body research and data continues to grow and all that stuff. So Doc, we'll check in with each other real soon, and everybody else will be talking to you as well.
Thanks. Good. Take care, man. All right. Bye-bye.
Bye-bye.